Welcome to This Explainer. Today, we're tackling something that is, well, deeply emotional and honestly pretty overwhelming for a lot of us parents. How children understand, process, and sometimes really fear the concept of death. It's a sensitive journey for sure, but as you're going to see, the research offers some incredible clarity and a ton of reassurance for navigating these challenging conversations with your kids.
Here is our agenda for today. 1. The death anxiety paradox. 2. How understanding death grows. 3. Answering the hard questions. 4. Sharing your cultural beliefs. And 5. Recognizing clinical red flags.
Section 1. The death anxiety paradox. Okay, let's start by just validating something very, very real.
How do we talk to our children about death? You know the moment. It's that question that completely stops you in your tracks. Usually you're entirely off guard, right? You're just driving down to the grocery store, or it's literally 2 minutes past bedtime, and suddenly a tiny voice from the back seat asks, "Are you going to die?" Or "What happens when we die?" It's a really heavy moment. Every parent has a terrifying, deep-seated instinct to shield their children from the harsh realities of mortality. We just want to protect them. But sometimes our protective instincts actually clash with what helps them feel safe.
Here's where it gets really interesting. Research by Slaughter and Griffiths presents the profound, kind of counterintuitive truth. Paradoxically, teaching kids the concrete biological facts actually reduces their fear of death. I know, right? As adults, we often think that stark biological facts are going to be way too scary. But for a developing brain, giving them the facts removes all that terrifying ambiguity.
So let's define what we're actually dealing with here. Death anxiety is a completely normal developmental milestone. It is not inherently a disorder. It usually peaks at a couple of very specific times. First, between ages 4 and 6, which is when kids finally grasp that death is irreversible, and then again around ages 8 to 10. That's when it hits them that it's universal, meaning, oh wow, this happens to everyone, including me and including my parents.
But let me reassure you right out of the gate. While almost all kids experience this existential curiosity and will inevitably ask these intense questions, only an estimated 2 to 5% actually experience death anxiety at a clinically significant level that needs intervention. So for the vast majority of kids, this is just a perfectly healthy phase of cognitive growth.
Moving right along to Section 2, How Understanding Death Grows. Let's map out exactly how a child's understanding of mortality progresses as they age.
Because look, your 5-year-old and your 12-year-old are experiencing two entirely different realities. From ages 4 to 6, kids are heavily into magical thinking. They might actually think their thoughts can cause things to happen. By 7 to 9, they hit that acute realization of universality we just talked about, and that's usually where the worry really kicks in. By 10 to 12, they're developing a much more concrete biological understanding. And finally, in those teen years, ages 13 to 14, they start grappling with complex, abstract existential fears about meaning and non-existence.
To break that down just a little bit more, a 5-year-old might use their magical thinking to wonder, did I cause my pet to die by being naughty? They still kind of think death might be reversible, almost like sleep. But you look at the 7 to 9-year-olds and they realize death is universal. So you might see brief panic episodes or them being super clingy. Then, by ages 10 to 12, because their biological understanding is really maturing, their fears often shift into very specific health-related anxieties. You know, things like worrying about catching a disease.
Which brings us to Section 3, Answering the hard questions. Knowing all this, how do we actually respond when they look up at us with those terrifying questions?
Okay, this might be the absolute most important takeaway of this entire explainer. We literally have to contrast our protective parenting instincts with evidence-based practices. When we use euphemisms like "they went to sleep" or "we lost them," it creates profound confusion for a kid who takes things very literally. Think about it. That can actually trigger intense new fears about simply going to bed or getting lost in a store. Instead, we need to use concrete biological language, saying something like, when someone dies, their body stops working, their heart stops, they don't breathe anymore. It sounds blunt to us, but it provides reassuring clarity for them. It gives their brain a solid logical framework.
Let's run through a few quick best practices. Do answer their questions honestly, at an age-appropriate level but without over-explaining. If they ask a specific question, just answer that specific question. Do normalize it. Tell them, that's a really great question. Lots of kids wonder about that. Do model healthy engagement, like caring for a dying pet openly. But whatever you do, don't shut down the questions or make it a secret.
And please, don't provide false reassurance. Saying nobody you love will ever die might feel incredibly comforting in the moment, but it can completely backfire and shatter their trust when a loss eventually, inevitably happens. Section 4. Sharing your cultural beliefs. Now, a question I hear all the time is, but what about our faith?
Well, you really don't have to choose between science and faith here. They can coexist perfectly. You can absolutely explain the biological reality that a body has stopped working, while simultaneously and gently sharing your family's deeply held beliefs about the afterlife. You might say something like, their body stopped working, and in our family, we believe their spirit goes to heaven. See how that works? It gives them the concrete foundation they need to stave off the anxiety, paired with the spiritual comfort that your family values.
All right, Section 5, recognizing clinical red flags. We need to clearly delineate when this fear crosses over into a clinical concern. Remember we said about 2 to 5% of kids will experience this at a clinical level? It's not about the fact that they're asking questions, it's about the impact it's having on their life. So what are the red flags? We're looking for persistent distress that lasts for months without getting better, severe sleep disruption or chronic nightmares, extreme avoidance of their normal daily activities, intense, totally unmanageable separation anxiety, or even physical, somatic complaints like chronic stomach aches or panic-like episodes. If you're seeing those things, it's time to seek professional support. Cognitive behavioral therapy, or CBT, is amazing for this and has a massive evidence base for successfully helping kids restructure these kinds of fears. To wrap up this explainer, I really want you to internalize this idea, and this comes straight from John Bowlby's attachment theory. You are your child's secure base. You don't need to have all the answers, you just need to be a safe place for their questions. As a parent, you don't have to be a philosopher, you don't have to be a theologian, or some brilliant scientist. Your most powerful intervention is literally just your calm, empathetic presence. When you stay calm and answer honestly, their nervous system actually co-regulates with yours. You deactivate their fear simply by being a safe, honest place for them to land. So, armed with the counterintuitive truth that biological honesty actually protects their peace of mind, how will you answer the next time your child asks about death? How will you choose to guide them the next time they look up from the back seat and ask you the hardest question of all? Embrace the honesty, trust the developmental process, and remember, you've absolutely got this. Thanks for joining me on this explainer, and keep learning.